Talking about inflammation and repair. So basically, what are lines of defense? For the body, we have physical barriers, protective cells and chemicals, and adaptive immunity. But basically, what are the physical barriers? Sweat, skin, oral mucosa, and these things are innate barriers, which means we're born with the ability to use them as barriers. We don't have to learn anything, it's totally natural. A natural way to protect our body. So again, we talked about skin, sweat, and sebaceous glands. All of those things cause a barrier to protect our body. Physical barriers, mucous membranes, which is epithelial layers supported by deep connective tissue, like we know. Goblet cells produce mucus to trap bacteria, and cilia helps sweep out bacteria to be coughed out. So, let's talk about inflammation versus immunity. So, inflammation is general, non-specific response. It's a process that happens the same type of way every time, no matter what the foreign object is. Immunity is a specific response that's learned, so that's the difference. Inflammation is general, non-specific, happens at the same time. Immunity happens in different ways, specifically geared towards the antigen. Everyone is born with the ability to have an inflammatory response. Remember, inflammatory is innate. It's natural. It's like our senses. But immunity is not natural. Immunity is adaptive. You have to learn, your body learns how to have an immune response. Alright, so the inflammatory process. It's more dependent on the severity and the duration of the injury than the type of injury. So inflammation depends on how bad you're injured versus what kind of injury it is. It's the body's way of preventing the spread of disease and destroying foreign objects. Inflammation, acute and chronic. So, acute means it happens really fast, doesn't last very long. Usually it's beneficial because it gets rid of stuff, and it is painful. So, acute inflammation is painful, and this is the second line of defense. And going back to our review, what's the first line of defense? First line is physical barriers like skin, sweat, cilia, etc. Now, chronic inflammation is different. Chronic inflammation is slow, lasts a long time, can cause damage to the tissues because it's constantly happening, and it often has no pain. So what's an example of that? An example of chronic? Well, chronic gingivitis is an example of chronic inflammation. Gingivitis that's chronic never goes away, even due to the constant removal of biofilm. And it doesn't hurt because the patients don't really know that it's going on because it's so chronic. Okay, what are the 5 cardinal signs of inflammation? Redness, heat, swelling, pain, and loss of function. So, what happens in inflammation? What are the type of cells that we see? We see white blood cells, which are leukocytes. And if you have a high number of leukocytes, that means there's disease present. What are the 5 types of white blood cells? Well, neutrophils, monocytes, lymphocytes, eosinophils, and basophils. And where do they come from? They all come from stem cells in the bone marrow. Okay? So, neutrophils. Neutrophils are the first responders. They show up at the site of injury first. The vast majority of white blood cells are neutrophils. They are 60 to 70% of white blood cells, in fact. They are primarily involved in acute inflammation. They defend against bacteria and fungus, and they are phagocytes, which means they participate in phagocytosis. Neutrophils eat bacteria and fungus, then they die, like a bee dies after stinging someone. So, after they die, their body breaks open and releases toxic enzymes. So that's neutrophils. Monocytes. Monocytes are the second responders. After neutrophils, then you have monocytes. When monocytes, they have 2 different names, so it's important to remember what you're talking about. Monocytes are called monocytes inside the blood vessel. And once they leave the blood vessel, they're called macrophages. These also are phagocytes, and they live longer than neutrophils. Why do monocytes live longer than neutrophils? Because monocytes don't die after phagocytosis, but neutrophils do. Okay, then you have lymphocytes. These are involved in chronic inflammation, and they're associated with osteoclast activity. They are natural killer cells. They target viruses and tumors, and they involve B and T cells in immunity. If an infection has been going on for a long time, this is the type of white blood cell you're going to see, lymphocytes. Let's see. Then you have eosinophils and mast cells. Eosinophils target parasites specifically. So just think, eosinophils, ew, parasite, E and E, right? And then mast cells. What do mast cells do? Mast cells contain heparin, which is an anti-clotting mechanism. And they also release histamine, which we know histamine happens in inflammation. So, just a little review. Why, as inflammation progresses, are there fewer neutrophils than macrophages? Again, neutrophils are first responders, but they die after phagocytosis. Macrophages don't die. That's why there's more of them. Why would a blood test show differential white blood cells count? Well, if you have a differential white blood cell, that means there's inflammation present. And what disease is associated with the proliferation of immature white blood cells? Leukemia. Okay, so let's talk about the chain of events in inflammation. What happens first? Vasoconstriction. What happens next? Vasodilation. So, vasoconstriction of the blood vessel, and then the blood vessels vasodilate to help get the white blood cells into the area. And then you have increased permeability of the cell, which means plasma is able to flow better into the injured tissue, which causes exudate, leading to anemia. And then you have increased blood thickness or viscosity. Why is this happening? Because again, plasma is starting to flow, so we're losing plasma out of the cell, and the white blood cells are starting to circle the border of the cells, which is called margination and pavementing. So now the red blood cells are all stuck together in the middle, which is causing the blood to clot. Exudates, what are those? You have serous exudates, which is made up of plasma, white blood cells, and it usually happens from a mild injury like a blister. And then you have purulent or suppurative exudate, and that's the gross stuff. Just think, purulent is pus, suppurative is super gross. So it's made of plasma, white blood cells, tissue debris, pus, and abscesses is where you're going to see it. Okay, let's see. So what's the good benefits of exudate? It contains chemical mediators that enhance the process of inflammation. It provides nutrients for inflammatory cells, dilutes toxins, inactivates toxins, and contains antibodies. What happens to exudate? Where does it go? It drains to the lymphatic system. It can drain through a sinus or a fistula, and then if it doesn't drain on its own, it has to be medically drained. Okay, immigration, what's that? Emigration is when white blood cells escape from the blood vessels. They're emigrating out. Chemotaxis is the direct movement of white blood cells to the site of injury. So just think, the white blood cells emigrate out of the cells, and then they get in a taxi and go to the site of delivery through chemotaxis. Then you have, and what causes the blood cells to know which taxi to get into? Well, that's biochemical mediators, okay? Then you have phagocytosis, like we talked about, which the white blood cells ingest the foreign substances, and they release lysosome enzymes, collagenase, which we see in perio. And we talked about the chemical mediators. These are organizers of the inflammatory reaction, and they help direct the action of the inflammatory cells, and they come from plasma and cells. Complement system, what's that? Complement system is composed of a series of plasma proteins that activate each other in a series of steps. They complement each other. So, complement system causes mast cells to release histamine, which then causes the release of opsonin. And opsonin is something that attaches to pathogens and makes them more attractive. So once this happens and you have opsonin, you enhance phagocytosis, and which the complement proteins attach to the surface of the bacteria, and they're more easily eaten by the white blood cells. Okay, what's the kinin system? Kinin system is early inflammation. Basically, it increases vasodilation and permeability and induces pain. The main role of it is to increase dilation and increase permeability. That's kinin. And bradykinin is the primary type of kinin. Clotting system, we know that. Clots blood, prevents spread of infection, provides a framework for tissues. Okay, systemic effects. What are you going to see if there's systemic inflammation? You're going to see fevers, which are caused by pyrogens. And then you're going to see leukocytosis, which is the increase in white blood cell count. And this is a disease known as leukemia. C-reactive proteins, what's that? It's produced in the liver and interacts with the complement system. It's elevated in acute inflammation and drops after it's controlled. So basically, it's a blood test that if you have these proteins and a lot of them, that means that there's an infection going on. Okay, what's lymphadenopathy? That means you have enlarged lymph nodes, and the lymph system removes all the waste. So if it doesn't remove waste, that means there's inflammation going on. Chronic effects, so in chronic inflammation, you have macrophages, lymphocytes, and plasma cells. These cells are going to be seen in chronic inflammation. You can also get a granuloma, which is just a big group of lymphocytes and macrophages, and it can destroy surrounding tissue. It's the body's way of trying to get rid of a foreign object, but the white blood cells just kind of wall around the object, and they don't ever really get rid of it. It just creates a big mass in the body. Okay, hyperplasia. What's hyperplasia? Hyperplasia is the enlargement of a tissue or an organ due to increase in number of cells. You see this in chronic oral irritation. So basically, hyperplasia, the cells are trying to reproduce and they keep reproducing too fast, and the number of cells just continues to increase, and the epithelium of the tissue gets too thick. And then you have hypertrophy. This is the enlargement of a tissue and organ due to increase in size of cells. So what's the difference again between hyperplasia and hypertrophy? Hyperplasia is the number of cells that are growing super fast to make the organ bigger. Hypertrophy is the size of the cells are getting bigger, which in turn makes the organ bigger as well. And then you have atrophy. Atrophy is a decrease in the size and function of a cell. So just think, trophy is like looking at something gets long and big. The size of the cells are long and big. Atrophy is going smaller. Some diseases are caused by chronic inflammation, cardiovascular disease, cancer, diabetes, asthma, COPD, Alzheimer's, and perio. Perio is chronic inflammation. So just to review, acute versus chronic. What causes acute inflammation? An antigen such as bacteria or dental plaque. What causes chronic inflammation? Unresolved inflammation. So basically, antigen or bacteria causes acute, and then it can turn into chronic. What cells are in the response to acute inflammation? Macrophages. And then what about chronic inflammation? Monocytes, macrophages, and lymphocytes. Is acute immediate? Yes. Is chronic delayed? Yes. How long does acute last? Several days. How long does chronic last? A very long time. Can tissue be healed in acute inflammation? Yes, tissue can be healed. Can tissue be healed in chronic inflammation? No, tissue cannot be healed. Okay, I think that's about it. And then just remember to go over repair and regeneration.